Okay, so it's good afternoon, good evening, and maybe I'm not sure whether we have the people from in the morning zone. So I'm Zahidul Qayyum. Welcome everyone, and this is a workshop basically. I would say, well, we are part of our DJPG's attempt to people get in touch with people and say their research experience and organize things, seminar or workshop, particularly for our researchers. So welcome to this workshop on social innovation monitoring and evaluation. And this is we know that we want to kind of really look at what the community social innovations and community engagement process, and that can help us to bring some social changes and ultimately impact on health. So I understand that Joe Tucker and his team have been working, and also Professor Afsana has been also involved with this work, and very interesting work as well. So it will be very good to know from the team and get ourselves engaged into that. So just a brief introduction about myself. I'm a professor at the James Brigant School of Public Health. I'm basically in health economics and also the director of research of the James Brigant School of Public Health. And also we have within the school, there are centers, and I'm also leading one of the centers called Center for Urban Health and Equity. So yeah, that's mainly more research in areas of urban health, apart from urban health and equity as well. So I will stop here, and I will pass on to Joe Tucker, to kind of take us through the whole workshop and seminar. Over to you, Joe. Thank you very much. Thanks.
Thank you, Professor Qayyum. It's great to be here, and thanks also to Professor Afsana. We're grateful for the opportunity and really excited to organize this workshop with you. And in terms of the format today, we'll have 2 speakers followed by a panel and then some opportunity for questions at the end. Our first speaker is Dr. Anai Pakri. She's a postdoctoral fellow at the London School of Hygiene and Tropical Medicine. Dr. Pakri is originally from River State, and she has a passion for antibiotic resistance and community-based social innovation. She is doing some really exciting work and co-led the development of a social innovation monitoring and evaluation conceptual framework. So she's going to tell us more about this conceptual framework and this specific project. So over to you, Dr. Pakri.
Thanks, Joe. I'll share my screen now and get started. Okay. Thanks, everyone, for joining us today. I'll be sharing on the social innovation, monitoring and evaluation, reintroducing and taking you through our conceptual framework. So over the next few minutes, I'll spend time to talk about the need for M&E, that's monitoring and evaluation. I'll describe the processes we took to sort of develop this resource, and then introduce like the core purpose and sort of the outcomes of engaging with this document. I would also describe the core of the document, which includes the 7 key phases we've identified, list some of the open access resources to help support people when they are considering monitoring and evaluation for their interventions and for their projects, signpost you to the availability of the document and how you can access it with all of the resources included, embedded, and then conclude with some acknowledgements. But before we dive into the world of M&E, I want you to take 5 to 10 seconds to sort of think and ponder. When we say monitoring and evaluation, what readily comes to mind? I know we have a lot of people who have implemented or carried out different diverse research projects in different resource limited settings or even in high income settings, diverse settings. And when we talk about social innovation, what readily comes to mind? I want you to think about that, ponder on it, and then hold that thought. So later on, when we come to discuss more about social innovation, we'll be able to hear from you. What are the new things you've picked up from this discussion today? So monitoring and evaluation for social innovations, really, it's very important because it helps us to understand what works and what doesn't work for any given project, any given intervention or implementation. You find out that many social innovations have limited data to support them. And this is especially true for those projects in low-income settings where the resources are not readily available. And up until now, there's been very few specific tools or framework to specifically measure and evaluate the social innovations in health. So the Social Innovation in Health Initiative, CHI, in partnership with the WHO TDR, organized a series of workshops. And from this, a clear need was identified to come up with a framework or a tool that specifically measures social innovation in health projects. Now I've highlighted Social Innovation in Health Initiative, that is the CHI. I know a lot of us might not be familiar, so I'm going to take 1 extra minute to sort of introduce the concept and tell us more about it. So CHI, it is Social Innovation in Health Initiative. It was officially launched in 2014, and it really is a global network of passionate individuals, organizations, institutions, all with a common goal, a common passion, advocating for social innovations in health. Now, we've been saying a lot of social innovations. Social innovations in health really means more inclusive, affordable, more effective solution to a host of health-related issues and problems in diverse settings. So in terms of their presence, we have CHI hubs, we like to call them the hubs, located in different areas around the world. So in the Asian region, we have the hubs in Philippines that also double acts as the CHI Secretariat. We have in Asia, we have in China, and in South to Central America, we have hubs in Honduras and Colombia. In Europe, we have a hub in Sweden. And then in the African region, we have hubs located in Malawi, Rwanda, South Africa, Ghana, Nigeria, and Uganda. And over the years, the CHI network has been able to identify over 44 health solutions in more than 17 countries. So looping back to that need, based on the series of meetings between the CHI network in partnership with TDR Global, identifying a need, we responded. So we put together a multi-step process to sort of develop the conceptual framework we will be reintroducing and talking a bit more about today. So first of all, we launched a crowdsourcing open call for ideas. We wanted to engage stakeholders in social innovation. So this would include implementers, innovators, researchers to sort of send us ideas or information that could sort of at the end of the day inform or contribute towards a framework specifically targeting social innovation projects. And alongside the crowdsourcing open call, we also conducted a scoping review because we wanted to access what information is out there in the published literature with regards to monitoring and evaluation of social innovations. So we put all of these findings together, analyzed the results, and were able to draft up a framework for M&E in social innovations. Now, we also had to convene a community engaged working group, and this met over a series of meetings and had a lot of multi-sectoral discussions to sort of refine and further finalize the framework. And when we had a near final document, we employed a modified Delphi involving stakeholders from different groups, specifically targeting those in low and middle income settings to sort of build consensus on the final inputs. And it's important to note that this whole process actually led to 2 key outputs. So we have a research checklist to sort of support people to report their social innovation in health projects. And then we also have the social innovation M&E framework, which I'll be talking a bit more. And my colleague, Dr. Chen, will shed more light on the research checklist shortly. So looking at the framework itself, the core purpose really is to serve as a tool for monitoring and evaluating our social innovation in health research or interventions or projects. You find out that M&E usually would help us to democratize research. What do I mean by this? It engages more stakeholders to work in collaboration and in partnership with the researchers. By stakeholders, this could be the end users, so the beneficiaries of the eventual outcome. This could be funders or donors to the project, or really those in political or governmental positions that can contribute and also help to co-create the solution. And at the end of the day, you find out that the outcome, the overall outcome of monitoring and evaluating our social innovation projects will help us understand the effectiveness. Like I said earlier, it helps us really to understand what works and what doesn't work, and also help us identify areas or gaps we could further improve our research projects. It also gives us an idea of the potential for sustainability. So how can we sustain our projects in the long term? And then for adaptation in different settings that's probably not where it was originally implemented. When you employ monitoring and evaluation, it gives you an idea of what can be further improved or revised to have it adapted in other settings. So now this wheel fully summarizes the core of the framework itself. I'll call it a wheel as it's very circular, but you could see at the very external circle, it has the end user feedback and co-creation. It's a consistent color, and that just indicates that it sort of goes round and it's applicable to all the core 7 phases we've identified and included. So at every point in the life cycle of your project or your intervention, you want to be thinking about end user feedback and co-creation, because at the end of the day, it helps us come up with more inclusive solutions. And then right at the core of the wheel, you find a dark blue square that we have identified 4 key pillars of social innovation. And this includes effectiveness, inclusivity, financial sustainability, and social benefit. So at every point in the life cycle of your project, these are the pillars of social innovation you want to be thinking about and sort of assessing all through your project. Now, the 7 key phases have been color-coded and sort of address different issues, but it's also important to note that it's iterative and they can sometimes overlap as you go about implementing your solution or your innovation, but to sort of place the phases at different strategic positions. Like for instance, for phase 1 and phase 2, early on in your project, you want to be thinking about opportunities and challenges and generating ideas. And towards the later phases, after phase 5, which is delivering and implementing, you want to be thinking about growing up and scaling up the projects. And then probably later on changing systems. How can we effectively integrate this that would lead to like the desired change or effectiveness? So like I said, this wheel just summarizes the core phases we've included for the M&E framework. Within the actual document itself, we've included more information. For each phase, there are specific issues we've signposted people to think about. And for each of these specific issues, we've sort of included the key techniques and research methods to help you address those issues, and also specific open access resources to support you when you implement those research methods. So talking a bit more about open access resources, we've identified a couple of very useful tools that people could sort of look into when planning their M&E for their project. So we've included basic M&E tools and training resources. We've added implementation research tools, other open access resources to help you with research ethics, and then for referencing, we've added softwares that are on statistics and focusing on data management, and a host of other general resources. Now, all of these are open access and you could get them through the main document itself. You could click and access them directly. So moving on to the availability and accessing the document itself, we've created a very beautiful digital interactive website that hosts the framework. The link to the website can be put directly in the chat box so you could access it even as we carry on discussing. And within this digital link and interactive websites, you could download a free copy of the PDF version onto your device for yourself. You could watch an introductory video, and then there's a link to the original launch of the framework. Like I mentioned earlier, the open access resources are all hyperlinked, so you could click directly and access them on your computers and devices. And very importantly, we've also included within the document the regional CHI contacts. So if after this discussion and meeting today, you're thinking of expanding your network, becoming a part of the CHI network, or just collaboration for your innovative solutions, you could reach out to the contacts or the CHI hub that is most relevant or closest to you. And before I end my discussion today, I'd like to say a very big thank you to all of our partners and funders for this project. Say thank you to our experts working group, everyone who met during the series of Zoom teleconference calls, deliberating and finalizing. I'd like to say thank you to everyone who also participated and helped us build consensus in our modified Delphi to finalize the document, and for others who helped with communications, assisting and sharing and publicizing the document. And we're sharing it with you today. Our hope is that you access the document and make good use of it for your research projects and for your social innovations. I'll stop here and hand over back to Joe. Thank you.
Thanks, Ine. That was wonderful. Our next speaker is going to look at how social innovation monitoring and evaluation can be used as part of a research checklist. And Dr. Liz Chen is an assistant professor at the University of North Carolina, Chapel Hill, and is also the design lead for Innovate Carolina, which is a pan-university initiative to help with social entrepreneurship, social innovation, and commercialization. So over to you, Dr. Chen.
Thanks, Joe. All right, so I'm going to cover the social innovation research checklist. And so, as we mentioned earlier, social innovations in health are really important, and how we define this for the work of the CHI M&E group was that social innovations in health are inclusive solutions that address the healthcare delivery gap that meet the needs of end users through a multi-stakeholder, community-engaged process. And as Ine mentioned earlier, meetings led by CHI identified a need for research tools like the framework, and we decided together to advance social innovations in health in low and middle income countries through the development of a checklist. And so I'll pause here and ask for audience participation via the chat. And so many of us have encountered checklists in our everyday and professional lives, and would like to hear why we think folks need checklists with regards to social innovation in health or in general. So I will wait 30 seconds and see what comes in. Why might we need a checklist? Great. All right. So a variety of different answers have come in. So we have checklists are good for transparency, for standardizing processes, to standardize reporting, so we don't miss anything that when we're planning, to guide us so we don't get lost, ease of implementing. And so it looks like folks are highlighting also different time points of when you could use it: before in the planning stage, during with regards to implementation, and then afterwards with regards to evaluation and reporting. And so for us, as we went through and came up with the reasons why and crowdsourced reasons from others that collaborated with us, we heard that it was really important to have a standard reporting of research findings and to have a checklist so that we could increase transparency, improve reporting completeness, facilitate easier comparison of studies, facilitate easier replication of studies. And to date, aside from ours, there haven't been any research checklists put forth for social innovation, and especially in health. And as Anae mentioned, we had a process to go through and develop both our framework and our checklist with the open call and scoping review, leading to a modified Delphi process. And then one of the outputs was this research checklist. So in the end, we had 17 distinct items. And as you can see, many of these overlap with other items and checklists that you might have heard of, like the tidier checklist for intervention reporting. And so we've highlighted 6 that's really set this checklist apart from others out there. And we'll give you just 10 seconds to read through all 17, and then I will dive a little bit deeper for the ones that we, how we differentiate our checklist from others. Okay, so I'm going to start with 4, 5, and 6. So social innovation, it seems easy. However, describing your solution or social innovation in detail so that others can understand what it is can be difficult, but we expect that folks who use this checklist and who do great work, especially in LMICs, can describe their innovation so others understand in different contexts what it is and visualize it. Number 5, it's really important to specify who your end users are. So the different groups of people that you hope to impact with this social innovation. And so it might be multifold. And for some interventions like Medic Mobile, they're a group that uses repurposed cell phones from different places and countries and uploads technology into it for community health workers to use in the field. They have multiple end users. So hospitals and hospital administrators are the ones who purchase the service. Community health workers are the ones who actually use the technology. And then community members who are patients, and then also doctors in area hospitals who are either served by these community health workers or receive information in clinic about folks in the community are all also end users. And then number 6, this is one that sets us apart, is the stakeholder involvement piece. And so we specifically ask with this checklist for folks to detail out the meaningful stakeholder engagement activities that they've used throughout the planning, implementation, and evaluation process. And so it's expected in social innovation research that you engage with your different groups of end users to make sure that they have an active voice in co-creating the solution. And then for outcomes 13, 14, and 15, our checklist is also different because we specifically think about sustainability and financing. So we know that sometimes social innovations are initially created, launched, and supported with some sort of grant funding, seed money, or philanthropy. And that's great. And it's really important for us to think through what happens once that initial funding goes away. And so how much do things cost for people who are buying this product or service? How much does it cost out of pocket for patients and families that are supposed to be paying into this? And what is the viability of this in the real world with regards to money? So that is important as you plan, implement, and evaluate. And then we've teased apart health impact and social impact. And so health impact, whether it's change in health related knowledge, attitudes, behaviors, or something else entirely, it's important for us to track and also report those health impacts. And then also additional social impacts, whether it touches upon education or other social determinants of health or anything else that is important that also impacts health. And so as we continue our discussion today, just wanted to show the user-friendly version of our checklist where it lists the item numbers 1 through 17, and then the brief name of the item describes the item and then gives you the ability to write in the page number of a manuscript or report for which it's reported on. And then for additional references for you today, the full article about the research checklist is listed here. I want to thank all of the different authors. And then we've also included 2 additional helpful references, one with examples and one that cites the definition of social innovations in health. We would also like to acknowledge the contributions of our TDR, CHI, SESH, and CETA partners in supporting this work. And then we'll end on this slide highlighting that we've developed a research checklist for social innovations in health with low and middle income countries in mind. The checklist can also be used by public health and healthcare workers in the field engaging in social innovation products and research. We really do hope that this leads to more reporting, greater transparency, and greater comparability and replicability of social innovations in health. And if you have additional questions, feel free to email myself or check in with Dr. Joe Tucker at jdtucker@med.unc.edu. And the QR code on the left does take you directly to the published article that documents our process for coming up with the research checklist, as well as accessing the PDF version of our checklist itself. All right, Joe, I will turn it back to you.
Thanks, Liz. That was a terrific presentation. Now we're going to shift gears a little bit and have a panel to discuss some of the key issues that have been raised. And this will give an opportunity to dig a little bit deeper into some of the issues. And if people do have questions, feel free to put them into the chat box. Our panelists are, you just met them, it's Dr. Pakri, Dr. Chen, and me. We're going to go through a few key topics. We're going to talk a little bit about inspiring social innovation, M&E, and within that topic, we'll talk a little bit about why would an organization do this, as Varun asked about. Then we'll talk a little bit about tips and strategies, practical things for getting started. If you don't have experience with M&E, or if you have a little bit, how do you get started? What are some tips and strategies? How do you form partnerships around social innovation M&E? And what are some favorite open access resources? So our first topic is about inspiration, and we're going to start with Liz. Liz, you've come across so many different social innovations, lots of different examples, and examples of social innovation M&E specifically. Tell us about one example that you've seen recently where the evaluation was really dazzling. That is to say, either this was like a study or a routine monitoring program that was really exceptional.
Yeah, there's 2 that come to mind. And Joe, I did actually go back to my notes and found one at UNC. And so we have a team interested in maternal child family health that has recently been working with UNC hospitals to reimagine what bassinets look like right after mothers deliver. And this is important because through talking with many patients, not only here in UNC Health, but also with collaborators in many different countries, this research team identified that there's a need for low cost but user-friendly bassinets in hospital and clinic settings. And with regards to their M&E strategy, they started collecting data and surveying mothers post-delivery during their intervention design process, but then have continued to measure outcomes and patients' reactions to all the different newer types of bassinets they've been trying. And so as a new mom, I have a 1-year-old now, some of the pain points that they gathered in some of the surveys with mothers that had just given birth included that it was annoying for mothers to have to stand up, or essentially they would need help lifting the infants out of the bassinet after delivery. They were very tired and they didn't want to actually get out of their beds to do that. And so the new bassinets can go up and go down bedside, and there are holes to be able to insert your hands and arms into the plastic bassinet. And so what I also really like about this solution was not only did they ask and collect quantitative and qualitative data during the design process, but also they asked hospital administrators how much they currently pay for the current bassinets so that they could make sure that whatever they offer was along the same lines, and so not too expensive. And so even though it has all these added features, they were able to create solutions that were on par for cost for the hospital. And so just being able to tell that financial story and be able to gather that information throughout really was impactful for that M&E strategy. And then relatedly, Phyllis Awar and her team, and this is one of the references I included in my presentation slide, working with Imaging the World Africa. And so we know that in some low and middle income countries, it's really hard to get medical professionals at every location who can actually read x-rays and other scans. And so there's a nonprofit that has different groups and different sites internationally that leverages the technology of smartphones and laptops to be able to send digital scans elsewhere and then have volunteers read them with medical credentials in other countries to come back. And so that group specifically also did a really great job collecting data about how many people were using this particular platform, how many scans were being done at each of the local clinics, the amount of time it took for volunteers in other countries to read these scans and then send that information back, and the amount of money saved at each clinic site instead of hiring full-time staff and doctors to be able to do this. And so those are just two examples of folks that I think did a really good job collecting data, not only on the way, but also on the back end, and then also collecting the financial data to strengthen the case for sustainability.
Thanks, Les. That's great. I like the baby in a box example. I'd heard about that in several Scandinavian countries have like the baby in a box, low tech, but I didn't realize that people were innovating around that at UNC. Very cool. Anae, do you have any sort of similarly exciting M&E examples that you think might be sort of useful or exciting for the group?
Sure. I'd like to share about one of my very first experiences implementing an intervention, so to speak, and trying to think about monitoring and evaluation, the impact afterwards. We were thinking to incorporate or embed antimicrobial stewardship in low-income settings within the hospitals. Then we were working in Ghana, and we had to use a very basic model, the trainer, peer educator model, because we're trying to implement the stewardship programs within hospitals, but then we thought the healthcare providers, the healthcare professionals would be the champions of the course. And our very first intervention was an educational training stewardship. We wanted to sort of train a selected cohort of healthcare providers to then become the trainers and then spearhead the mission of implementing and actually embedding antimicrobial stewardship. So for this, clearly we needed to know if our very initial intervention was going to work or it wasn't going to work. And then we had the thoughts of how do we measure impact? How do we know that for a truth, people are more aware of antimicrobial resistance, people are more aware of the factors that contribute to it, and this then ultimately translates into practice. So thinking about that right at the beginning was able to give us the idea that, okay, if we're doing an educational stewardship, if you're doing a train the trainer, we need to get like baseline understanding, baseline knowledge, baseline practice. So this loops us back to the cycle, the wheel of our very beautiful framework I shared, where you see the outer core had the end user, the end user feedback and the co-creation. So at the end of the day, we worked for monitoring and evaluation for that project. We had to work closely with the end user. At that particular first phase, our end users were the healthcare providers who were training. So we sort of gathered baseline knowledge and we implemented the educational intervention, training them within the hospitals. And then later on, when we came back down the line. I think we did an evaluation at 6 months and at 1 year. So at 6 months and 12 months, we were able to loop back to our very first data collected for baseline knowledge, baseline awareness and practice. It was a KAP study. And this sort of showed us the trend on where there's been improvements in knowledge after the training and in knowledge within other healthcare professionals that were not part of the initial training. So we sort of were able to measure and monitor the impact of our original intervention for the first selected cohorts and then sort of sustainability in the long term. So this was one of my very first and interesting experiences with monitoring and evaluation. And over the years, being involved in a group that has developed and brought to light an M&E framework, it's even giving me more sort of understanding and appreciation of the whole idea of monitoring and evaluation. Joe, I'll turn to you now. You also have a lot of experience and with social innovation, monitoring and evaluation. From your perspective, what do you think it's a very outstanding example of a really exciting social innovation, monitoring and evaluation project to study?
So I saw a really cool paper in Nature a couple of weeks ago from Katie Milkman. She's a behavioral economist, and they did what they called a mega study, where they evaluated 54 interventions, and all of these were promoting exercise and like telling people to go to the gym. And they enrolled 61,000 people at a gym that was all over the United States. And some of them were definitely social innovations. Many of these ended up working. And they interestingly also looked at sort of, they put together some different judging panels and said, all right, if we take judges who are experts in this part or experts in that part, will the judges be able to predict which ideas would be best? And not surprisingly, there was very little correlation between what judges thought would happen and what actually worked in practice. And that really underlines the importance of monitoring and evaluation and sort of testing ideas. It's great. It's easy to have an idea and just to say like, oh, okay, this is what we think will happen, but it's quite another to actually implement it. And so, I mean, I think that for me, that was a really kind of cool example of M&E that's sort of implementation research, actually getting people to stay at the gym and keep to their fitness workouts. Now let's turn to our second topic about starting and sort of what are ways, if someone doesn't have much experience on M&E, how do they get started? Liz, tell us what's your advice for people to sort of jump into M&E?
Yeah, it's a great question. I think the two things I would highlight would be, one, go back to your end users, so the stakeholder group that you're hoping to impact with the social innovation and health, and really understand what are the changes in knowledge, attitudes, or human behavior that you're trying to achieve. And a key part of this is also asking the end users themselves about what they would hope that this social innovation would lead to. I think that making sure that you have a clear understanding about what your team and research team is trying to strive for, and asking the end users is really important. And then once you've figured out what it is that you're hoping to measure, essentially going back and playing to your strengths and identifying what resources you have access to with regards to types of data collection. And there's plenty of qualitative and quantitative ways that you can assess how things are going along the way and then at the end. And so if you have interests in a background doing interviews and focus groups, it might be a natural fit for you to collect data in those ways. If you are more familiar with surveys and quantitative data analyses, it might be efficient to also do that. And as Anae mentioned earlier, We've linked many open source resources, some that do offer tips on both qualitative and quantitative research for the framework in the interactive page. So I think that those are all great places for folks to start. So in some, go back to your end users and also ask them what they're hoping to gain or change, and then 2, play to strengths and the resources that you have access to.
Oh, Steve.
Thanks, Liz. That's great. Thinking about the end user, playing to strengths. I think that's great advice. And anything that you'd like to add on in terms of how to get into the M&E parts of social innovation?
Yeah. In addition to that, and Liz, I totally agree that the end user, the beneficiary, it's very important to think about them, because at the end of the day, you want your solutions, your innovations to be as inclusive as possible. But one other thing to sort of think about early on is the most important metric or indication or measure of impact of your project. For example, in the world of AMR, antimicrobial resistance, and implementing antimicrobial stewardship in different settings, we often think about, or we often measure antibiotic use, rational antibiotic use as a key indicator. So within hospitals, we're always trying to reduce the number of antibiotics being prescribed unnecessary for patients without a bacterial infection. So in that sort of scene, or in that sort of scenario, you want to see how you can effectively measure that metric. We all know in research, most times self-reported changes can be troublesome. There's a lot of, all levels of bias could be introduced. So it then brings us to the point again of having a specific tool and sort of measuring this impact in a standardized way and in a standardized format. So in that light, we could then have something to guide us, or for example, the example I gave in AMR, you then want to have an additional check to measure those indications or those metrics. It could be going back to administrative reports or patient folders, or just assessing the prescribing reports to see over time how the impacts of your intervention or your social innovation has sort of translated into practice and sort of generated the desired outcomes. And in all of this, we could also make sort of reviews or changes along the life cycle of the project, sort of adjust. So M&E really, it's something to consider early on during the project and not just at the end, because at the end of the day, it really guides you to sort of refine and further improve your project. Over to you, Joe.
Well said, Anaine. And the other point that actually Baby Nazneen brought up in the chat box is thinking there are often sort of technical gaps within teams about performance indicators, data preparation, interpretation. So when the social innovator needs support, technical support, how do you form partnerships, and like how do you find the right people to partner with? That's a really important question. And I think there's a couple of different ways. Within CHI, the Social Innovation and Health Initiative, CHI has these research hubs that are set up really with lots of expertise on the side of research, on the side of sort of monitoring and evaluation, and finding other partners. So I think CHI resources in your country are worth thinking about. And then also many of the folks in the audience are at universities, and universities are another way to sort of expand partnerships. Anae, do you want to tell us a little bit more about CHI and sort of how CHI can help social innovators to develop partnerships related to M&E?
Sure. In the course of my presentation, I touched a bit about the Social Innovation and Health Initiative, CHI. We like to pronounce it CHI. Hi. Yeah, so CHI really, it's a global network of research hubs. So this could be individuals, it could be nonprofit organizations, or even academic institutions, higher level institutions, universities, and all of that. So they are located, like I said earlier on, in different regions. The Philippine hub serve or double acts as the secretariats. We also have other Asian groups in Indonesia, in China. Within the African region, we have hubs in Malawi, Rwanda, South Africa, Ghana, Nigeria, Uganda. And then in Europe, we have one in Sweden. And in Central South America, we have one in Honduras and Colombia. So each of these hubs can really help to build partnership for monitoring and evaluation. They often have experience, as Joe said, linking up social innovators to researchers and then to other stakeholders. This could be government officials, this could be the end user, to make your innovation more community engaged. And in all, they have a deep passion for social innovation and ongoing partnerships to funders, like I said, to key government stakeholders and other people who could play a key role. Each of these hubs are a great place really to turn to when considering M&E. The CHI website, I know it's been popped earlier when I mentioned it in my course of my presentation, but the CHI website has a lot more details, and I encourage everyone who's not yet part of a network to explore the relationship and seek out their advice. Many of them are actually, many of our CHI actors are actually on the call today. I know I can see Noel and Meredith from the CHI Secretariat in Philippines. We have Yana, and from China, we have Wei Ming on the call. So do well to go on the website, look at the different hubs, see how you could connect or be a part of the network, expand your work, and just say hi. Thanks, Joe.
Thanks, Anae. Sorry, thanks, Anae. The other part of this, in addition to CHI, universities also play a role, and I think they can bring together groups. Liz, you've worked with a lot of diverse researchers at UNC. How do you see universities and sort of institutions of higher learning being catalytic in this process?
Yeah, I think that units within the university that focus on innovation, entrepreneurship, and economic development can support a greater ecosystem and especially connect folks with different skill sets. And so through various research projects at UNC, we see that there are lots of folks with expertise in M&E methods, techniques, and tools, and folks in anthropology in particular can bring their skill set in qualitative research. We have folks in computer science and math who are really great at modeling and computing. And then again, there are units like mine at Innovate Carolina that also helps with the sustainability, business modeling, and actual translation into the real world. And so I think that universities can serve as connectors and be more strategic in supporting projects that are across many different sectors and disciplines. And therefore, I hope that more universities have units who can actually dedicate their time and resources to doing social innovation specific work. And I know that we've been trying to develop more partnerships with local government in the last couple of years at Innovate Carolina. And I do think that, Joe, especially in your work, you've spent a lot of time working with governments. And so with regards to social innovation research, it'd be great if you could share more about how that's happened and evolved and what it might look like.
Yeah, governments are a really important stakeholder in social innovation, monitoring, and evaluation. They're ultimately the people who will decide, is this program going to be sustained or not? And in our crowdsourcing research, we've had public officials and sort of public health folks involved as judges, as steering committee members, as participants. And these help our team to better understand from a public sector perspective, what are the gaps? How can research fill these gaps? And really, government partners in China have encouraged us to use cost effectiveness research and to think about financing issues, because ultimately these are important considerations for many policymakers. And I think the other interesting thing, sort of in the Chinese context, it's often not going to be like a research manuscript that'll move the needle. It's more like a banquet dinner and informal discussions that end up allowing you to kind of make a point or to convey the importance of a research topic or social innovation. And I know we're sort of approaching the top of the hour. I wanted to get into a little bit more about open access resources, but what I would suggest is maybe Anae and Liz, if you could just jot down in the chat box your favorite open access resources, a link to whichever one, and then we can go ahead and get into the questions. There were a couple of questions in the chat that I think are worth diving into in greater detail. And I'm going to put mine. ODK is an open access software that can be used for online surveys, and it's also in the it's within the social innovation monitoring and evaluation conceptual framework. And Liz is putting in the IDEO's Field Guide to Human-Centered Design, which is also, it's a great resource. And so I know we've only got a few minutes left. I'd like to go back to Varun's question about what's the role of the community, and actually, Varun, we've already had sort of a little bit of a chat in the chat box, but do you want to ask your question to the group, or?
Yeah, happy to. So my question stems from the background of so far as a public health nonprofit in India, we have been working in the biggest government hospital in every district of a few states, and that's usually a tertiary care center. And of late, we have started working at the primary levels as well, which are mostly clinics, right? So these clinics are many more in number than the tertiary care centers, obviously. And hence, as we roll out our program in these clinics, our challenge is now to monitor the progress of how these programs are being run. Obviously, it's much easier to track these in larger hospitals because they are fewer in number. So we ourselves have the field staff to visit these hospitals once in a while and talk to the nurses and see how things are going. But as we roll this out to the community levels, the village levels, and so on, it becomes difficult for us to do. So we were just trying to see, whether we could partner with other local organizations to try and monitor the program, or is there a way like small community groups, like self-help groups or so on, whether they can keep an eye out on what's happening in their local clinic and report back to us once in a while. So yeah, that's where I had the question from.
Thanks, Varun. And I think it's really this point about what's the role of the community and how does community engagement work in social innovation, M&E? What does it look like? It's a key question. Anae and Liz, do you have anything else to add on that point?
Sure. Thanks, Varun. That's really, really important. Like I said earlier, just reiterating the whole process of monitoring and evaluation. You want to keep the end users, the community, the beneficiary involved right from the beginning, because at the end of the day, it's the outcome of the innovation that really matters. And we found out from our experience, when it's more inclusive, when there is co-creation, then it becomes really more effective. So people are open to using it more, and then you get a lot of positive impacts. I'll stop here. Liz, over to you.
Yeah, I'll just add in the resource that I shared from IDEO.org, it's just one example of a resource that offers ways to meaningfully engage with stakeholders, especially with co-creation. And so I engage in community-based participatory research also. And we always think of power and decision-making. And so I really do think this emphasis on co-creation, so not just tokenistic, people are consulting or getting a seat at the table and just kind of checking on what researchers have offered or nonprofits have offered, going beyond that and truly offering ways for community members and end users to lead in many ways what they hope solutions could look like, because they are the experts of their lives and add a lot of value, especially when we're looking for something that is going to be sustainable, desirable, and feasible.
Yeah, great points, Liz. Thanks. Yeah, and I feel like this issue of sort of what's the level of community engagement, that if a social innovation can from the very beginning have this sort of authentic relationship where the community is engaged early on, I think it really sets the tone for the whole, for not just the beginning, but the middle and the end of a program or a research study. And it makes the outputs also more relevant to the community, that if you have the end beneficiaries or end users involved, then it increases the likelihood that you're designing for them, that they'll be that this is not sort of done in a silo, but it's really carefully listening to what the local needs are and the gaps. And I know that we're just about out of time. We're at the hour. I'd like to thank again Professor Qayyum, to thank Professor Afsana and the BRAC team, also the Social Innovation and Health Initiative. Thanks to Professor Huban and Professor Del Pilar Labarda. We're grateful for your support and excited to have organized this training workshop. There's, as both Dr. Pakri and Dr. Chen mentioned, there's just a slew of open access resources. There's more and more rigor being introduced to social innovation research. And I think this area is only going to grow. We know that social determinants are really critical, and COVID has sort of underlined that. So Annie and Liz, any final thoughts before we wrap it up? No? Okay. All right. Well, email us if you have questions. This was really engaging. As we mentioned before, this has been recorded, and we will make sure that it's online. Perhaps we could put it onto the CHI website, if that's okay with the CHI Secretariat team. And Meredith's sending the heart. Cool. And yes, I hope everyone has a joyous new year, and be safe. Thanks for joining us.
Thanks, everyone. Happy
Thank you.
holidays.
Thank you very much. Thanks.
Thank you, everyone.
Thank you.
Good. Thanks, everyone.
Happy holidays. Thank you.
Thank
Thanks,
you.
Joe, Liz, Nay. Bye.
Thanks, Noel. Bye-bye.
Yeah.
All right.